Thank you for joining us today. I'm Danielle Kachi. I'm the Public Relations Manager here at Tampa General Hospital. We want to give a special thank you to Leah and her family. Mom is Nadia and Dad is Jay. Thank you guys so much for being here. We know this has been an unimaginable tragedy for you guys, and you've been through a lot. There's been a lot of attention on the case, so we thank you just so much for being here, being brave enough to share your story today. Just over a week ago, as many of us know, Leah and her family were just enjoying a regular day at the beach, and she was unfortunately attacked by a shark. But thanks to the quick response of those who are up here with her, many of the people that we have in the audience today, and several others beyond these walls, Leah is here with us today. She was airlifted to TGH and Muma Children's Hospital at TGH and received life-saving care at one of our state's leading academic health systems. So today you're going to hear more about the complexity of her case, the importance of her being transported here to TGH, as we are the only level 1 trauma center in the region that's verified by the American College of Surgeons that provides treatment to both adult and pediatric patients. So again, I wanted to do a couple introductions. I know we have a lot of people here, and we'll try to remind everybody who's speaking, but we'll start off on this side. This is Dr. Alfred Hess. He is an orthopedic surgeon at TGH and an upper extremities specialist with Florida Orthopedic Institute. Next to him is Dr. Joshua Linnell. He's with the hand and microsurgery departments at TGH. He's also a plastic surgeon and upper extremities specialist at Florida Orthopedic Institute. On the other side of Nadia, we have Dr. Jade Kumar. She's a pediatric surgeon at Muma Children's Hospital at TGH and Johns Hopkins All Children's Hospital. We also have Dr. Norma Lise Rodriguez. She is a pediatric emergency medicine physician at Muma Children's Hospital at TGH and the director of simulation for the Department of Emergency Medicine at USF Health. And then finally, we have Dr. Thatch. He's our medical director of pediatric trauma and surgery at Muma Children's Hospital at TGH, and he's also with Johns Hopkins All Children's Hospital. So a lot of big titles, but as you guys will start to hear, we had a huge team effort on this one, so we wanted to make sure that we brought in a lot of the specialists here. Just to share with everybody, we will let the family and our experts speak first and give a little bit of background on the case, and then we'll transition and open up to you guys in the audience for questions, if that's okay. But I'm going to try to keep us on time because I know some of us up here have to get to appointments. So bear with us and we'll keep us on time. But I think we are going to start with our VIP guest of honor, Miss Leah. Leah, do you want to start off and share what you remember from that day at the beach, and then maybe what happened? How did you get to us?
So I didn't see anything. I was just snorkeling. Then I went up to breathe, and then something hard bit me, and then it tried to tug me away. Then I pick up my hand, and it's all in blood. Then I started screaming with my mom, and then my dad was with me. He picked me up, and we ran to the road. And he I don't know.
It's okay. Were you pretty scared? Dad, go ahead.
Well, I'll explain my point of view of the day that it happened. So I had a day off. I usually work in Boca Grande, and it's beautiful beaches over there. So I decided to take my family out for a beach day. When we got there, we went out to the lighthouse. We walked around a little bit over there. Then we grabbed some ice cream in downtown. And then we decided to go to the beach. So we parked, we got our umbrella, we set it up, and we went swimming, snorkeling. And then closer to 12 o'clock, we decided to grab some pizza so we can eat at the beach. So I went to the shore, grabbed my phone, I called the sister's restaurant, ordered some pizza, and then I put my phone away. I went back into the water, grabbed my 2 older kids, and we went out like maybe 20 feet out into the ocean, and we were snorkeling there. And then in about 10 minutes after that, I heard some yelling by the shore. So we're snorkeling, and I pick up my head, and I see everybody, like some commotion going on. And I see Leah pick up her hand, and this, from far away, it looked like a crab grabbed her or something like that. So I started swimming as fast as I can to the shore to help her, like with the crab, or that's what it looked like. And then when I was getting closer with the 2 other kids that were swimming behind me, I noticed that it was her arm that was almost like falling off. So like instantly I figured out that it was a shark in the water. So we quickly got out of the water, and then there was construction people running at the same time. And then one of them helped us tie her arm so it stops the bleeding. And then they were calling 911 at the same time. There was a few of them. And so I pick up Leah, I take her to closer to the street, and I went and grabbed the towel, I wrapped it in the towel, and then that's the time the EMS came. It was a very quick response. It was like 3 minutes. And then we were airlifted to the hospital.
Dad, you mentioned that you were the one who traveled with Leah here. Can you talk a little bit about once you got to TGH, Muma Children's Hospital at TGH, what was the care like? I'm sure there was a swarm of the people who were in the room.
Yes, it was amazing. It was like at least 50 people all around, and it was just, yeah, I was trying to hold myself together. I think I was crying more than she was. So, but yeah, it was very, very quick response. I'm just thankful for everybody. I'm just very thankful she's alive.
Mom, do you want to just chime in on your experience?
Yeah, so like he was saying, we were out and we were just enjoying the day with our kiddos. We don't get to do that often because he works a lot. And so we were just having a great day. You know, we're swimming. As he said, he took the 2 older. Leah, she always stays behind. She doesn't really like to go in the deep. She's always kind of around me. And so I had 2 more little kids with me. I have a 1-year-old and a 2-year-old. My 1-year-old was in like a baby floaty, so I have to hold her. And my 3-year-old was in toddler floats, and she would kind of drift away a little bit to the side, like maybe a foot or 2, and I just kind of pull her back. You know, I try to keep him close. And Leah, she was on my left side, and she was about 3 to 4 feet away from me. So she had just gone under, like I watch her, and she had gone under, and then as she was coming up, I heard like this yell or scream, and I saw like the fling of the arm, and it was like almost completely gone, you know, in that second, and there was so much blood in the water right next to me. I mean, in that instant, I knew it's a shark attack. I mean, I didn't expect it, but we've seen documentaries before, and we've seen encounters. I knew, you know, and so in that second, I just started to scream to my husband. I started to just scream for help, and when we were spending time on the water, I did notice that there was construction people that were working there, and I noted that they had come out to lunch. I was like, it's probably 12 o'clock because they're eating lunch. And so I started screaming, and I was trying to grab both of my little ones, and Leah was already running. She was so quick. Her instincts kicked in. I'm so thankful that she was able to do that and not like get, you know, traumatized and shocked and just stand there. She ran out. I was just a few feet behind her running with the 2 little ones. The construction people, they responded to my scream. Like, they were running so fast, and as they were getting closer, I was just screaming, please, somebody call 911, call 911. My daughter, she got bit. They couldn't understand me right away. You know, they just don't know what's going on, and so they thought that something was out in the water. And so they're like pointing to my 2 little ones that I had pretty much like placed on the shore, a few feet away from the water, kind of away in safety. And so they were like, is something wrong with them? And I'm like, no, look at my daughter. And so when they saw her hand, it was really, really hard for them, to see them kind of like all grab their hearts. And so they were right on the phone. They were calling, and I was like, can you guys tell them we're probably going to need air flight for her? Like, I could see she was bleeding really bad. My husband had run out of the water. He tried to hold her hand, and they tied it, and then he carried her to a palm tree, like under a palm tree. He placed her there, and then the EMS came. Yeah, it was really traumatizing.
I can imagine. Once I know you met, and Dad, feel free to chime in too. Once you guys got to the hospital here, what was that experience like? We were saying, you met a lot of people, probably don't even remember faces until today. But were there any specialists, any experiences that you recall once you were in the hospital about her care?
Everybody. The fact that they had, I couldn't come right away because I was at the little ones, and I had to wait for someone to fly in and stay with them so I can come and see Leah. He was sending me, photos of volunteers coming in, like the dog, Belle and Millie, and they were coming in. There was more volunteers coming in to play with her, and just everybody that was taking care of her was doing such a great job. From what I witnessed, I didn't think she's going to have a hand. It was really, really bad. It's some sort of miracle that God did in her life that now she has a hand. And when my husband said, babe, she can move 2 fingers, I was just like, praise God. It's a lot. So yeah, I'm very thankful.
I also didn't think it was possible because I was holding her hand in my hand, and I didn't think there was any chance at all of saving it. And I'm just so thankful to the surgeons for making such a miracle.
Yeah, for the time and patience that they took, and they took such good care of her. They knew what to do. Like, it's a lot.
What did it mean to you guys to have this access to this level of care from a trauma hospital like TGH during a terrifying experience?
I don't think we could get anything better than this.
Yeah. Same. First they said they were going to take her somewhere else, and then they made the decision to take her here. And, I trust them. I'm so thankful that they made that decision, the air flight and everybody who was involved.
And Leah, I don't know if you want to chime in. We mentioned a friend that we have over here named Belle. Do you want to tell us who Belle was and how she helped you hang in here with us? Even though you had to be in a hospital room, how did she make your stay better? This is Belle, our facility dog, by the way.
She always came to lick me and play with me.
We'll let her sit with you for a little while. Is that okay?
Yeah.
And this is Mandy, one of our child life specialists. I don't know, Mom or Dad, do you want to chime in on?
Yeah, it was very. Yeah.
She loved it. I know. She was like, when is she coming? And then she would tell her older sister about it. And her older sister, Jemima, got to visit her. And she's like, when are they coming? I want to see them. She really wanted to meet them.
It was a Sunday, so they weren't able to come.
Yeah. She was pretty upset.
Anything else that you guys want to mention about your care too? I know, like I said, we'll open up for questions at the end, but just anything else that you wanted to mention about the care, anything about the team and just your experience overall?
I'm just happy. So everything was such in a timely manner that it's such teamwork that without one person it wouldn't have been done. So it was just more of a teamwork and time.
Yeah, like the construction people, if they weren't there, when you're in this moment, it's like you probably don't even have in your mind, like, where do I even search for my phone? And I was screaming for help. They were there. They had their phones. They called. Like, everything was so fast. The fact that EMS was there so quickly. And then the air flight was able to take her. Everybody was needed. The doctors, everybody.
Let's start talking with you, Dr. Hess. You've been around here for a while. Would you tell me 30 years, right? 35 years. Talk about the team effort that it required to get Leah here doing as well as she can be right now.
Yeah, well, so first of all, we're celebrating a great outcome, and I'm really happy about that. you know, I've worked here for 35 years doing this kind of work, and it's not always this happy. So we're so glad that everything turned out the way it did. And it does. It takes, I think a politician said it takes a village. It took everybody from the start to, you know, the timing, the first responders that said go straight to Tampa General because timing is so important. Getting the patient to us as soon as possible is very important in saving a limb. So I thank them all for that, from the ER to the EMS. And you know, this can only be done as a team effort. It takes everybody to do the right thing, and we're there and able to do it, but only if what we have to work with is viable, and you know, we're able to put it back together, and it was in this case. I mean, a shark injury, it's both a curse and a blessing in this case, because the shark's teeth are so sharp that the cut through the wrist is clean and not jagged, and it doesn't ruin all the tissue, so that we have good tissue to work with and put back together in a timely fashion. And that's about all I can say about that. You know, getting the patient to the room stable and with a nearly viable extremity is important. And
I think you answered the other question about, you know, had you seen a shark bite before and how this compared to other injuries that you've seen? I don't know if you want to touch on that before we talk to Dr. Lendel.
Sure. I mean, I've seen several different animal injuries, from, you know, alligators to, you know, lions to to shark bites. And shark bites are they're a different. It's like a bunch of razor blades, a shark's mouth, and they go through tissue, and it's just the way the tissue is approached by the mouth and how it happens if you have something left to put back on.
Thank you. Dr. Lendel, can you talk about the difference of an injury? Like Dr. Hess was saying, you guys have seen other maybe bite injuries, but how does this compare from a pediatric hand trauma to an adult?
So, you know, certainly, you know, as a father myself, we look at kids' injuries a little bit differently, and certainly it can get your adrenaline going and your heart racing a little bit quicker. You know, in these situations, you know, as Dr. Hess alluded to, time is everything. And so, you know, we know that there's this critical time about that 6-hour mark where we start to lose muscle. And so that's the key, is getting those patients into the operating room. With regards to pediatric patients, you know, structures are smaller. And so that makes repair of vessels, repair of tissues a lot more difficult, a lot more complicated. And so, you know, we know when we get that call that, you know, we have to be on our A game and have to be ready to do things under the microscope that are going to be a lot more complicated than in the adult patient.
And I don't know if you want to speak to any of the surgery, how long the surgery took with her.
Sure. So, you know, in this situation, when they called me to come in and to help, certainly what you're going through in your head when you first get that call is, you know, what tissues are injured, what am I going to have to do? You're working that through your head as you're coming in, trying to make a plan so that you're not going in blindly. And so, you know, I'm used to dealing with a lot of these types of injuries from, you know, being from Kansas from a farm injury standpoint. And so we deal with stabilizing the bone first. That's the key, is having a base to work with. And so once we've done that, then we can start working on getting blood flow back. And so that was, you know, key to the success of this, was having Dr. Hess there immediately to be able to stabilize the wrist and be able to stabilize that base so that we could then work on getting blood flow back.
And I think we have a couple shots of the x-rays that our team is going to pull up so you guys
So
can see. And we'll be happy to send these out afterwards.
So we wanted to stay away from obviously all clinical photos, as you know, they're pretty graphic. But if you can take a look at that x-ray, you can see there's quite a bit of soft tissue loss on that on that outside of the wrist. And so the concern was, you know, what do we need to do to stabilize the wrist so that we can work with the stable base? How do we bring that blood flow back? Because we've got that 6-hour mark coming quickly by the time she was flown in. And so I knew that when I was looking at pictures and looking at the x-rays that we were going to have a pretty sizable defect within the blood vessels, and so we had to span that gap. And so that's why we went to our leg to grab some vessels so that we could use that to bypass into the hand. And once you get that blood flow back, that's when your heart rate starts to come down. That's when you can really, you know, start to breathe again. And so if it wasn't for the fellows, if it wasn't for the team, you know, that's impossible to do. And I've worked in a lot of different settings, and, you know, this was the best by far. So I would say that, you know, after you get the blood flow back, you start to calm down a little bit. You can take a deep breath, start fixing the tendons, start fixing the nerves, making sure all the bones are in the proper position, and then getting that skin closed. And thankfully, we were able to get everything closed, because I was pretty sure as I was driving in that she was going to need more operations, just due to the fact that, you know, you tell me shark bite, and I think there's going to be a lot missing. And so we were very lucky in this situation to be able to close everything at that point. So.
I know you're about to be a closer part of their family because they have some follow-up appointments with you. Not to get too much into the details, but what is the post-surgical care? What does her recovery look like now?
Yeah, so rehab with hand injuries is complex, certainly, because we have to balance the strength of tendon repairs with the scarring that's going to occur in the area. So in a situation like this, when you have tendon injuries on both the front and back of the hand, then we have to start to work those tendons so that they don't get scarred into the area, but at the same time not push too hard to allow for those tendons to heal before we really start tugging on them. And so that'll be the process that our therapists will work with her. And we have therapists that certainly, you know, specialize in pediatric hands. It's a different case in peds, because they do tend to scar a lot less, and you have to be very diligent, especially with younger folks. Leah's a very smart little girl, I can tell, so I don't think she's going to have any problem with that whatsoever. But I will say that then we have to start working on getting those pins out of the wrist and start working on getting that wrist moving. And you can see in that second x-ray that certainly, you know, she's got some pins that will have to come out. And so it's just a balance of motion and decreased scarring. So,
What is, I should have asked this earlier, what is the yellow foam contraption that she has on? What's the purpose of that?
Yeah, so my patients love that. So the cheese pillow or the Carter pillow. So certainly keeping that, keeping everything elevated, keeping the swelling down. You know, swelling causes pressure. Pressure causes problems with blood flow, and causes problems with scarring and stiffness. And so if we can keep those joints from swelling, then we can certainly keep them mobilizing. And so she's done a fantastic job, I can already tell you. And I just keep looking over at those fingers because we worked hard on that.
Dr. Kumar, from the perspective of pediatric surgery, how important was it that Leah received care so quickly here at Muma Children's Hospital at TGH? And then can you also speak to we say multidisciplinary care, but we're going to explain that for you because not a lot of people may understand. That means a whole team. But Dr. Kumar, why don't you talk about how that impacts?
Yeah, absolutely, thank you. So from a pediatrics perspective, time is a big thing. We want to be able to stabilize the child as quickly as possible, and a lot of things go into that. A lot of people go into that. So the second any child comes in through the door, we're doing a full head-to-toe assessment. That includes our ER colleagues, that includes our trauma nurses. We also have child life there, our pharmacists, because as we're assessing her, we want to make sure, does she have good IV access? Does she need blood transfusions? Things like that. We're making those minute-to-minute decisions so that we can get her to her next phase of care, whether it's a CT scan or, in her case, she went to the OR less than an hour from when she came in through the door. And that, goes into in the long run, how her outcome was as far as being able to reattach her hand. And so our job was to quickly get her into the ER, stabilize her so that we could get her to her next portion of care, and that included everyone in the ER down there with us to help us do that.
Speaking of the emergency center, Dr. Rodriguez, you were probably one of the first faces that Leah and Dad saw. They may not remember, like we said today. I'm sure it was a blur, but you see a lot of emergencies, obviously, where you're at. A shark bite, though. How does the emergency department and your team prepare for something like this?
So that's a great question. How do you prepare for the unknown? So usually the information that we get when any patient is coming in is their age and what happened. So all we know is a 9-year-old female shark bite. People assume we know more, but we don't. And then they'll give us the amount of time from which they might arrive, right? So I think it was like 10 or 15 minutes. So we all move to the room to prepare for her arrival. And we prepare for the worst, but hope and expect the best, right? So we have everything that we need in order to manage the worst case scenario, because I don't know what's coming. We didn't know it was her hand, for example. It could have been any extension of injury. And really those high stakes, low frequency events, we train for that every day through medical simulation. Through our academic centers. We practice it every single day. We practice it in our teams to improve our communication, to improve our medical decision making, so that we can be prepared for any event that is usually unknown to us in the ER. And I think that's the advantage of getting care at an academic center, where you really don't only have us, because it wasn't just us there, it was all of our residents, right? The ortho resident was exceptional, really meticulously checked the pulse in all of her fingers, and then ran to get her an OR immediately. So it's really far beyond even us as attendings, but really our large academic program that really allows us to thrive in these moments.
Thanks. And Dr. Thatch, you lead our pediatric surgery and trauma program here. Talk to the comprehensive nature of all the experts that we have in the room today, and explain what goes into care for a case like this.
Yeah, I think here at Movement Children's Hospital, I think that's a big proponent of what we do. And I think it's also, we were the first American College of Surgeons Level 1 pediatric trauma center in the state. And we're the only one on the West Coast. And what does that mean? That means that anything and everything can be taken care of here. And so we pride ourselves on being only one of a couple places that has the National Hand Trauma Center Network. And we have the benefit of Dr. Lendel, Dr. Hess, and their team. We have benefit of multiple specialists across everything. And so, as Dr. Rodriguez says, we're ready for anything. And we're ready for anything from the aspect of that acute trauma care, getting them resuscitated in that trauma bay, to the OR, and having the OR, as soon as that's activated, our OR is prepping in case they have to go there. So they're ready. They're warm in that room. They're making sure it's warm. She was in there by 45 minutes. She was ready. Then to the recovery, we have our pediatric ICU, we have our child life, we have our neuropsychologist, we have our kind of every specialist that possibly is needed. We're going to have our physical therapists and mostly occupational therapists in this case really work on her long term. And you need that collaborative care for this whole repair and this whole kind of result, to be quite honest with you. And that's not offered anywhere else. It's why they decided to fly 2 hours in a helicopter to us, because they knew that we could handle it, and they knew that we would have the best chance of kind of repairing and making.
Yeah, go ahead, Dr. Hess.
So I just wanted to say that decision in the field to fly directly here was monumental, because if they would have flown to another hospital and then had to go through all this and then were flown here, we'd have been well outside of the 6 hours that we like to revascularize a hand. By flying directly here and having the great care that they had in the ER here, and then getting them immediately to the OR, we were able to revascularize the hand within 4.5 hours. So that is so much better for the tissues and the recovery and the future function of this hand.
And I promised I'm going to try and keep us on time. I know we have our reporter friends in the audience. I'm going to try and look behind here. Kylie, anybody? Hi. Anybody have questions out here? Yep.
I didn't see anything. So when that happened, and you kind of glance around, I didn't see nothing at all, and that scared me more.
What was it like just having them there? Because when I talked on the phone, he was like he was with her every step.
Yes, yeah. He helped tie I think my husband was with him when they tied. What did he have? He had like a strap, I think a work strap. One of the men was trying to take off a shirt because we didn't have anything. I was like, can somebody take off their shirt or something so we can stop bleeding somehow? And so one of them did start taking off a shirt, but then another man had that strap that they tied. So we're very, very thankful to them for being there, you know, at that moment to help us.
And doctors, how important is that when someone gets bit by a shark? What should they do in the meantime to get to where you guys are?
So yeah, you know, that's obviously in a situation like this, you know, everyone's helping and trying to, you know, make sure that she gets to the appropriate place. And I think just the recognition of the other hospitals, especially in that area, recognizing that this is above the level of care that they can provide, and that's that key is making that decision early on to get the life flight involved, to get them to transfer immediately, and so that's the important part of it.
Yeah, the only other thing I would add to that is that the tourniquet, obviously, how just critical that is. You know, putting something above that, whether it's a belt, anything you have, strap it above it. We commonly are teaching Stop the Bleed. It's a huge campaign that we are part of, American College of Surgeons is part of. We offer classes all the time. If you see those, please take them. It's really critical out in the field to kind of help us through those moments. We can't do anything if we lose that time in the field. And so you have the ability to really save a life. And so put something on there, try to stop that bleed as you can, put something above, especially in extremities, put some sort of kind of device to kind of just tighten it down. It's going to hurt, but it's going to stop that bleed. If there's something somewhere else, put direct pressure, take your shirt off, put your shirt on their belly. If there's the bleeding there, put it directly on there, hold pressure and don't let go. And we will, if you can get it to us, hopefully we can do the rest.
Kylie, go ahead.
That's good, Leah. You are a champ. I think we all think you're a huge champ in this room. How were you so brave during all of that?
I don't know.
She didn't have a choice.
I don't know.
For those of us on this side of the room, that's the beauty of pediatrics.
Yes.
The beauty, and that's why we love being here at Moomin Children's Hospital, is because these kids are resilient. They teach us something every day. We as parents struggle. We are the ones getting the gray hairs left and right, and they are teaching us. Their resiliency makes this job that much easier.
Lisa, just tell us how you're feeling. How are you doing right now?
Very good.
Anything you're looking forward to doing once your hand heals? Anything you're excited about?
Playing with all my siblings.
Yeah, I've seen this.
Doctors, it's obviously going to be a long road to recovery. Can you talk a little bit more about how that therapy is, how long the therapy is really going to have to drag out, and if there are any long-lasting impacts from reattaching Leah's hands?
Sure. So, yes, I mean, what's been said about pediatrics is great. I mean, the pediatric patient has a much better chance of recovering because they're young. She has open growth plates. She's still growing. Her tissues are so much better than adults. And so her recovery we expect to be better, especially with nerve function. You know, when the entire wrist is severed like this, so you have to repair, you know, vessels is the first thing, getting the blood back to the hand, which we did in a timely fashion, which was great. But also we repair the nerves, and those just don't click on. It's just like turning a light switch. They have to grow back, okay? And children have a much greater chance of gaining sensibility to their hand, so sensation, and reinnervating the little muscles, the intrinsic muscles in the hand to get coordinated hand function. So we think that she should get all of that back, we're hoping, you know, and we want to see what her wrist does, because this cut was very unique. It went right through the carpus, right through the wrist joint, and so we have, you know, pinned the wrist joint, and that will scar back in, and then we just have to see how that is going to respond as far as getting wrist motion back.
And mom and dad, you also have other children as well. Can you talk a little bit about Leah's siblings' reactions to everything? Obviously, it's pretty shocking for them too, since they were so close to everything.
Her older sister, they're very, very close. They're like besties, you know. They grew up together. They're only a year and like 4 months apart. And so Jemima, that's the older one, when she had reached the shore, she was crying. She was falling over. You know, she didn't know how to help her. She kept praying. She was really traumatized. My son, he's younger than Leah, and he had like a shock. He kept screaming, like yelling, traumatized. He was just like, you know, like he couldn't. So I was trying to, while my husband was tending to her, I was trying to calm them all down. And that's another thing, like the construction workers there, they were helping me. You know, one of them took one of my little babies and tried to hold her and just kind of pat her on the back. And it was just so kind of them to offer that. There's a lady that was that lives in one of the houses who had come out, who was trying to calm me down, you know, and help me with the kiddos. She helped me put them in the car seats so that I can go home. She brought us water. She was just it was so nice to have people who are just there, you know, who are so kind. But yeah, it was a lot for my children to see this. Like, they were kind of scared for a while.
Leah, this was obviously a very scary situation. Do you plan to go in the water anytime again?
Yes.
What about your mom? Yeah, more family trips at the beach.
You know, this is not something that always happens, and they know it because all our kids were raised at the beach. Leah was born in Hawaii, so they've been at the beach since they were little, and they've watched so many documentaries. They love this kind of stuff, you know, the encounters and this and that. And I think, you know, that's another thing that helped their knowledge of what to do. Like, she had a very good reaction of what to do. So that did help her. But yeah, I mean, I think we're going to be swimming. That's their favorite thing to do. It's like their playground.
Any other questions?
Leah, if you could talk to the construction workers again and these amazing doctors, what do you have to say to them?
Thank you.
Any other questions that we're missing? Thank you guys for being here.